How to solve NCLEX pharma questions prioritizing safety using ADPIE. Are you struggling with those tricky NCLEX pharmacology questions? Don't worry, I've got you covered. In this video, I will explain this with 10 most relevant examples so that you won't forget the process as you walk for your NCLEX exam. We will also be solving some multiple options questions and cases. I will be explaining why each options could be right or wrong in detail. So, without much delay, let's start with what is a ADPIE? The nursing process is a step-by-step method that nurses use to make safe and informed decisions for their patients. When dealing with medications, these steps ensure patient safety by guiding you through what to do and when. Let's break it down. A stands for assessment. In this step, you collect data about the patient's current condition before doing anything. This includes checking things like vital signs, lab results, and physical symptoms. So, why do we start with assessment? We start with assessment because you need to know what's happening with the patient before deciding what to do next. For example, if a patient is prescribed digoxin but complains of nausea, you first check their potassium levels because low potassium increases the risk of digoxin toxicity. D stands for diagnosis, which is related with understanding the problem. Here, you analyze the data collected during the assessment to identify the patient's problem. This step helps you decide what the priority is and what needs to be addressed. Why? Because understanding the problem helps you focus on the most important issues first. For example, if a patient has bruising while on warfarin, the diagnosis might be risk for bleeding related to anticoagulant use. This helps you determine what to monitor or adjust. P stands for planning, or to make a plan to solve the problem. In this step, you create a plan that focuses on the patient's safety and the best outcomes. This includes deciding when to give the medication, what to monitor before and after giving it, and any additional precautions to take. Why? A good plan ensures the medication is given safely and effectively. For example, before administering nitroglycerin for chest pain, you plan to check the blood pressure first because this medication lowers blood pressure and can cause harm if it's already low. The next step, I stands for implementation or put the plan into action. Now it's time to do the intervention. This could mean administering the medication, educating the patient about the medication, communicating with the healthcare team if there are concerns. Why do we do this? This is where you follow through with your plan while keeping the patient's safety in mind. For example, if a patient is dizzy after taking antihypertensives, educate them to stand up slowly to avoid falls. E stands for evaluation, where we check if the plan worked. Finally, you evaluate the results of your actions. Ask yourself, did the medication work as expected? Were there any side effects or complications? So, why do we do this step? This step ensures that your intervention was effective and the patient is safe. For example, after giving morphine for pain, check if the patient's pain level has decreased and monitor their respiratory rate to ensure they don't experience dangerous side effects like slowed breathing. Let's see some more examples to understand this concept better. Example number 1. If a patient on digoxin reports nausea, assess potassium levels before notifying the provider. Nausea is a possible early sign of digoxin toxicity. Since hypokalemia increases the risk of digoxin toxicity, it is critical to assess potassium levels before making decisions about holding the drug or notifying the provider. Example number 2. If a patient prescribed insulin shows signs of confusion, check blood glucose before administering. Confusion may indicate hypoglycemia. Administering insulin without checking blood glucose could worsen the situation. A rapid blood sugar check ensures safety. Example number 3. If a patient taking warfarin has bruising, assess INR levels before holding the dose. Warfarin increases bleeding risk, and bruising could be a sign of excessive anticoagulation. INR levels must be assessed to determine if the warfarin dose needs adjustment or if the patient requires vitamin K. Example number 4. If a patient with chest pain is prescribed nitroglycerin, check blood pressure before administering. Nitroglycerin lowers blood pressure by dilating blood vessels. Administering it to a patient with hypertension could lead to dangerous levels of decreased perfusion. Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, And it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions. You've got this. Example number 5. If a patient on furosemide reports leg cramps, assess for hypokalemia. Furosemide is a loop diuretic that can cause potassium loss. Leg cramps are a sign of hypokalemia, so serum potassium should be checked before continuing the medication. Example number 6. If a patient prescribed morphine is drowsy, assess respiratory rate before giving the dose. Morphine depresses the central nervous system, including respiratory function. If the patient's respiratory rate is below 12 breaths per minute, the medication should be held to prevent respiratory failure. Example number 7. If a child prescribed amoxicillin has a rash, stop medication and assess for allergies. A rash may indicate an allergic reaction to amoxicillin. Stop the medication immediately and assess for other signs of allergy, such as wheezing or swelling. Example number 8. If a patient on lithium shows tremors, assess serum lithium levels. Tremors could be a sign of lithium toxicity, which occurs when serum levels exceed the therapeutic range, 0.6 to 1.2 milliequivalent per liter. Monitoring lithium levels ensures safe dosing. Example number 9. If a patient on antihypertensives reports dizziness, check orthostatic blood pressure. Dizziness is a common side effect of antihypertensives and could indicate orthostatic hypotension. Measure blood pressure in different positions, lying, sitting, standing, to confirm this before notifying the provider. Example number 10. If a patient on heparin has hematuria, assess coagulation panel, PTT. Hematuria is a sign of excessive anticoagulation. Monitoring the activated partial thromboplastin time, PTT, helps assess the degree of anticoagulation and guides decisions about dose adjustments. Now let's see a multiple options questions and see if you can apply what we have learned so far. Don't worry. I will take the examples and scenario out of whatever we learned so far. A 72-year-old patient is admitted to the hospital with a diagnosis of atrial fibrillation. The patient is currently taking warfarin to prevent clot formation. During your morning assessment, you notice significant bruising on the patient's arms and legs. The patient denies any recent falls or injuries. What actions should the nurse prioritize? Select 2 correct answers. The options given to you on the screen are option number 1. Hold the warfarin dose and notify the healthcare provider. Option number 2. Assess the patient's INR levels to evaluate coagulation status. Option number 3. Administer vitamin K to reverse the effects of warfarin. Option number 4. Continue the warfarin as prescribed and reassess later. Option number 5. Document the bruising and continue monitoring for other symptoms. Option number 6. Educate the patient about avoiding injury while on anticoagulants. You can pause the video if you need some time to go through the question, but for now, let me reveal the answer. The correct answers to this questions are Option 1, which says to hold a warfarin dose and notify the healthcare provider, and Option 2, which asks to assess the patient's INR levels to evaluate coagulation status. Let us see in detail why each options are right or wrong. 1. Hold the warfarin dose and notify the healthcare provider. So what step is this? This is a planning and implementation step. This is a correct answer because significant bruising may indicate excessive anticoagulation and an increased risk of bleeding. Holding the warfarin dose prevents further anticoagulation while awaiting INR results, and notifying the provider ensures timely medical intervention. Also, there is no D or diagnosis step in the options. 2. Assess the patient's INR levels to evaluate coagulation status. So what step is this? This is assessment. The INR level is critical in determining whether the patient's anticoagulation level is within the therapeutic range 2.0 to 3.0 for atrial fibrillation. Abnormally high INR values could explain the bruising and guide the next steps. 3. Administer vitamin K to reverse the effects of warfarin. So what step is this? This is implementation. Vitamin K should only be administered after confirming an elevated INR level or at the provider's direction. Prematurely reversing anticoagulation could increase the patient's risk of clot formation. 4. Continue the warfarin as prescribed and reassess later. What step is this? This is evaluation. Why is this incorrect? Ignoring the bruising without assessing INR levels or notifying the provider could lead to severe complications, such as internal bleeding. 5. Document the bruising and continue monitoring for other symptoms. This is an evaluation step. Do you know why is this incorrect? It's because, while documentation is important, it is not the priority. Immediate action, such as holding the medication and assessing INR levels, is necessary to ensure patient safety. 6. Educate the patient about avoiding injury while on anticoagulants. This is an implementation step. So why is this incorrect? It's because education is important but not a priority when dealing with acute symptoms such as bruising. The focus should first be on assessing and managing the patient's anticoagulation status.